today's video, I am going to show to you the proper procedure of hand washing. Okay, so hand washing. It is a basic and most effective infections control measure that prevents the transmission of infections. So, the purpose of hand washing is to reduce of microorganisms of the hands, to reduce the risk of transmission of microorganisms to clients, and also to reduce the risk of cross-contaminations among clients, and for the last is to reduce the risk of transmissions of infectious organisms to oneself. So, before we do the hand washing, make sure that the equipment are all set. We have liquid or bar soap, towel, paper or cloth, lotion, but also optional, trash can, tissue or paper towel. So, before we begin, we have to assess the hand. Nails should be kept short. Remove all jewelry, including wristwatch. Check hands for breaks and cuts of the skin. So, stand in front of the sink. Do not allow your uniform to touch the sink during the washing procedure. The sink is considered contaminated. Uniforms may carry organisms from place to place. Turn on water, adjust the force of water flow. Water flush from the contaminated sink will contaminate your uniform. Wet hands thoroughly from wrist and pointing fingers toward the bottom of the sinks. Hold hand from lower than the elbow. Water should flow from the cleaner area toward the more contaminated area. Hands are more contaminated from the forearms. Apply enough soap to cover all hand surface. If liquid soap, apply 2 to 4 ml. If it is bar soap, rub firmly between the hands. Rinse to return the soap dish. Rinsing the soap removes the lather that may contain microorganisms. Rub hands briskly and starting palm to palm. Ensure formations of lather during the process. Rubbing motions and creating foam out of soap help loosen dirt in the hands. Friction caused by firm rubbing and rotation motions help to loosen dirt and organisms that can lodge between fingers and the skin. Revises of knuckles on palm and back of the hands as well as the wrist of forearms. Place the right palm over the dorsum with the interlaced fingers vice versa. Rubbing motions and creating foam out of soap help loosen dirt of the hands. Palm to palm with fingers interlaced. Back of the finger to opposing palms with fingers interlocked. Rotational rubbing of left palm cups in the right arm. Contaminations of hands extends until forearms depending on the activities the person engaged with. Rotational rubbing backward and forwards with clasped fingers on the right hand and left hand and vice versa. Continue the friction motion for 15 to 20 seconds. The length of hand washing is determined by the degree of contamination. Rinse hands with water. Running water rinses organisms and dirt into the sink. Pour the dry that does not recommended recontaminated hands. This prevents the nurse from taking microorganisms from the faucet hands. Dyeing the skin will prevent tapping. Dry hands to finger to wrist. Use a